Hello and welcome to today's presentation. Today we are looking at the respiratory system, and here we are interested with identifying respiratory patterns together with the breath sound. So let's start with identifying respiratory patterns, and we start with apnea, and this is the absence of breathing. It may be temporal or periodic. Remember, these are normal finding in the neonates. Okay, this is how it appears as the pattern, and the possible causes includes mechanical airway obstructions, conditions that affects the brain respiratory center. Next, we have the bradypnea. Is characterized by slow, regular respirations of equal depth. This is how it appears. Okay, and this is a normal pattern during sleeping. And conditions that can also affect or cause bradypnea include tumors, metabolic disorders, and respiratory decompensation. Use also of opioids and alcohol or both has also been found to be causing bradypnea. Chain stroke breathing is characterized by gradual increase in respiratory rate and tidal volume. Then we have gradual decrease in complete apnea, which may last several seconds before gradual increase again as the cycle repeats. And this is how it will be appearing. It is caused by brain injury or stroke. Also, heart failure, kidney failure can cause the chain stroke breathing. Drug-induced respiratory depression. We also have cerebral anoxia and may occur in older patients during sleep. All right. Eupnea. So this is the normal breathing rate and rhythm. Okay. And this is how it will be appearing. It is going to give us the normal respiration. Yeah. In adults, we'll be having 16 to 20 breaths per minute. We have the Kussmaul breathing. The Kussmaul is characterized by rapid, this should be over 20 breaths per minute, with also deep resembling the size and the labored respirations without a pulse. This is how it's gonna be appearing, and it has been implicated in kidney failure and metabolic acidosis, particularly diabetes ketoacidosis, guys, DKA, because of the presence of their ketones. Lastly, we have tachypnea, and this is a rapid respiration. So the rate increase corresponds to increase in body temperature. So generally, we normally say we have about 4 breaths per minute for every 0.5 degrees Celsius or above normal. Okay, so for every 0.5, we have the 4. All right, so this is how it's going to be appear, very rapid. It's found in pneumonia, compensatory respiratory alkalosis, respiratory insufficiency, when we have lesions in the brain stem, in the brain respiratory center, and also the salicylate poisoning. It caused tachypnea. What about breath sounds, guys? For breath sounds, we have the normal breath sounds and the abnormal or adventitious sounds. So the normal breath sounds, we have 4. We have tracheal breath sounds, and these tracheal breath sounds are normally found over or heard over the trachea. They are normally harsh and discontinuous. Bronchial sounds are usually heard over the fourth intercostal space between the sternum and the mid-clavicular line. They are loud, they are high-pitched, they are discontinuous, and loudest when the patient exhales. Bronchovesicular, these are heard when the patient inhales or exhales. They are medium-pitched and continuous. They are best heard over the upper third of the sternum and between the scapulae. Vesicular sounds, these are heard at the rest of the lungs. They are soft and low pitched. Okay, we have prolonged during inspiration and shortened during expiration. Okay, so during inspiration, they are prolonged in, then they are shortened during expiration. The adventitious breath sounds, these are the abnormal sounds, breath sounds. So we have crackles, These are intermittent, non-musical, brief cracking sounds caused by collapsed or fluid-filled alveoli popping open. So heard primarily during inspiration and are classified as either fine or coarse, usually don't clear with coughing unless caused by secretions. Wheezes, these are high-pitched sounds that heard during um, fast during expiration. So they result from blocked airway and also heard during inspiration when airflow is severely blocked. The ronchi are the next one. These are low-pitched snoring, rattling sounds that occurs primarily during exhalation, usually due to fluid or secretions in the large bronchial airways, may change or disappear with coughing. Stridor. This is loud, high-pitched crowing sounds that occurs during inspiration. So typically audible without even a stethoscope. They are usually caused by obstruction of the upper airway and requires immediate interventions. Okay, in the Krebs disease. Okay, laryngotracheal bronchitis. Lastly, we have pleural friction rub. These are low-pitched sounds. They are rubbing sounds heard during inhalation or exhalation. They result from pleural inflammation and causes and that causes the two layers of the pleura to rub against each other and may result in pain in areas where the sound is heard. Okay, so we have those 5 abnormal breath sounds. So we have some of the commonest conditions and the type of breath sounds that is elicited. For normal breath sound, you're going to have the vesicular breath sounds that are soft, low-pitched sounds heard throughout the inspiration and early expiration. For asthma, okay, for asthma, the condition normally causes wheezing, which is high-pitched and musical sounds heard during expiration, often in both phases. Okay. Bronchitis, we have the rhonchi. These are heard during expiration and sometimes inspiration. What about pneumonia? For pneumonia, we have crackles, this fine cracking and bubbling sounds heard during inspiration and often associated with fluid or mucus in the airway. We have the COPD, okay, and the COPD, chronic obstructive pulmonary disease, will have the wheezing, okay, like asthma, high-pitched musical sounds heard during expiration in both phases. Pleural effusion, okay, pleural effusion, this is decreased or absent breath sounds over the affected area. Then we have the pneumothorax. Pneumothorax, this is decreased or absent breath sounds over the affected area. Okay. So affected area for that's for larger pneumothorax. And then you could have hyperresonant percussion notes, okay, over the affected area. Next we have pulmonary edema. Okay, in pulmonary edema, you have crackles. These are normally heard during inspiration and often associated with fluid accumulation in the lungs. Then we have the pleural rub. Okay, pleural friction rub. This could be the sounds because of the two membranes, the two layers rubbing against each other. Okay, and could be heard during inspiration and expiration. Atelectasis, this is the collapse of the alveoli, and here we normally have decreased or absent breath sounds over the affected area. Croup disease, okay, the laryngotracheal bronchitis, yeah. Here we have the stridor, and this is high-pitched, harsh growing sound heard during inspiration, often in children. So those are some of the types of the breath patterns and the breath sounds and the various conditions that can be involved. Thank you so much.